And today I'm talking about my experience in internal medicine. And this experience is a little bit different from where you do internal medicine is. So my internal medicine was that I was a nurse practitioner contracted into a nursing home, and then I would be the provider for the building. And in this building that I did some, I don't know, different nursing homes are different. This particular nursing home had a TCU unit, which is an intense care unit, um, inside the nursing home. So the building I had two long-term care and I had intense. In the company I work for, they consider themselves almost like hospitalists. So we do the rounding, we do all those things. So it's not quite primary care like in our office. But the reason I want to talk about this experience because as a nurse practitioner, it was things that I did not know that I was going to have to deal with or compensate with. And being in internal medicine or even close to hospitalist, one thing about the difference is that in this nursing home setting, these patients do not go home. They're in this building all the time. And that right there means that even though you're not on call, you're still constantly dealing with all the problems. So if you're not on call that night and they call a provider, you still come back and have to be dealing with that situation. So it's a very, it was overwhelming and it was very challenging. And because you had so much responsibilities, not only were you responsible for the patient, you would have things like maybe I would be looking at my annual labs and my synthroid, and my thyroid was off, and we would have to go out on the floor to make sure the synthroid was given. Not that the fact that the patient didn't even like it was off and we need to adjust it. It was almost like you couldn't adjust it because you actually had to verify that nurses have been given it. And that's just something that I wasn't mentally prepared for because not only was I trying to check behind myself, you find yourself checking behind other nurses. And I'm an instructor and I want nurses to come out and do a great thing. But a lot of these situations or settings really change how we take care of people. So we would have to make sure that the nurses would give medication. I also would have to go on the floor and actually talk to nurses. And when I first got there, because I am always in school, I'm always teaching or I'm doing clinical, it keeps me around and it makes my mind a little more um, brilliant to what we do and keep those standards because I stay in it. I notice that when I go out, a lot of nurses, once they go work, they don't really think about how things are supposed to be done the right way. They kind of do it how the facility's doing it. So I would find myself initially asking, like, oh, okay, something's wrong with this patient. What was your nursing assessment? And then they would just look at me. So even when I got there, the first 2 or 3 months, it was really rough trying to make sure nurses would give me a nursing assessment. If the CNA gives you assessment, then you go check and you do your assessment, then I'll come in and do an NP assessment. So as far as on the MD side, we had a medical doctor who came in, and when he would come in, he had his own assigned patients. But if I needed anything or if I needed to contact someone, if it was something that I wasn't sure about, then I could always either call another MD or I could call another nurse practitioner, which I would say that first year I was trained very properly. I had a DNP before me and I took her position. She went into psych after that, and I was trained very well. I also had a wonderful, magnificent medical assistant who had already been in the facility. She knew all the patients, she knew their protocol, she knew that, and that really helped me out a lot because and also that building I was in, I also had been an agency nurse there. So going to a place, it wasn't a new building, but I was in a new role. And in that role, I had to learn how not to be like a nurse at bedside. Because as I explained that I was actually telling nurses how to do their assessments, I had to remember I had to go back into my office and do a whole nother treatment, diagnosis, and charts kind of thing. So not only was this a very interesting and demanding job because when I would say that in this building, my long-term care patients, we did 30-day visits on them, and we also did annual labs, and we would do any acute visits if they needed it. But I would say had a very high demand pre-Madonna type patients, and I love mental health. I love talking to people. So I had to learn how to balance not to be in the room talking to them about their kids and their grandkids because I had a job to do, and I was able to tailor that to get to it. But at the same time, we had an intense unit, and these patients would come in. It kind of remind you of a step down. I was still ordering labs. I was still having to check hemoglobins. I would have to send people out for blood transfusion. We couldn't do it in house. We still had people that was critically sick, checking troponin levels or everything. So my IQ there had to be very diverse because I got long-term issues over here, maybe some thyroid and maybe some checking seizure medicines and labs and all that. We did have unit managers, I just know that that year, even though it wasn't my first NP year, that was my first NP doing internal medicine. I came out of doing women's health, so that's a specialty. And then I went into mental health, which is another specialty. So going into internal medicine was a eye opener for me. I love it. It was great. I've only did it for a year, and the reason I did not continue to do it is that I came home with a lot of charts to actually go around, get back, check labs, get your orders, make sure if we need to call physicians, do everything. I still would come home, and I was one of those providers. I wanted my charts done. I didn't like notifications. They did give us time to do it, but I realized it took a lot out of me, and I wanted to make sure the right provider was in that position. And for me, with my children and everything, it just was too demanding. Again, in my specialties, it wasn't as demanding. It was a great experience. I learned a lot.